Good afternoon, everyone. Thanks for joining us on our new hour-long Krem 2 News First at 4. I'm Tom Sherry.
And I'm Mark Hanran in for Whitney tonight. A day after Providence Sacred Heart announced they will be pausing all non-emergency surgeries, we are hearing from their chief medical officer. His name is Dr. Dan Getz. He is frustrated, and he says they're at their highest level of admissions since the start of the pandemic and the closest to the breaking point that they have ever been. Listen to these stats. Dr. Getz says right now they have 18 patients on ventilators in the ICU. None of those patients are vaccinated. He says if you are unvaccinated and you end up on a ventilator, you have about a 60% chance of dying. That is especially frustrating for him because statistically, none of those patients would be in the ICU had they just gotten vaccinated. During normal times, he says Providence is able to accept about 90% of transfer requests. Now they're only able to accept about half of those requests. Right now, they are trying to expand their ICU to the PACU as well. That's a post-op recovery space. And because they're caring for so many sick COVID patients, people like cancer patients are not getting the care they need because there's simply no space. Given the current situation, Dr. Getz says he simply can't believe our local leaders are allowing the Spokane County Fair to take place.
I'm incredibly concerned that we have a big fair going on in Spokane. That makes zero sense in the middle of a pandemic, and we're hearing reports that we're lucky if a quarter of those patients are wearing masks. And so what it tells me is the community doesn't understand the level of crisis that we're dealing with. They don't understand the incredibly difficult decisions that we're making and delaying care in people that have cancers that we should be reviewing now because we need to make space for them in our hospital in case they get sick.
Dr. Getz also addressed people who are reluctant to get vaccinated, saying it's a personal decision. He says it's not a personal decision because if you get COVID and you require hospitalization and care, that is taking away from patients that need things again, like cancer treatment. Finally, Dr. Getz said misinformation on social media is leading to deaths. The science is clear, he says. The vaccines are safe and effective. Masks are proven to slow the spread of COVID. We'll have more from Dr. Getz coming up on Krem 2 News at 5 tonight.
Well, the Washington State Hospital Association says hospitals are, quote, actively canceling surgeries because too many people have COVID and they need the space. The state reported Tuesday that 7,037 Washingtonians have died from COVID-19. Hospitals are not denying life-saving treatment in order to treat a COVID patient, but they are delaying or canceling treatments, even things like knee replacements or cancer treatments. There are currently 1,673 people hospitalized with COVID-19 in Washington hospitals, and more than 95% of those are unvaccinated.
She was too weak to write, but she wanted to write goodbye letters to her family of 25 people or so.
Well, that was a nurse at Kootenai Health. She was one of several people to speak at a press conference today aimed at helping people understand what our hospitals are like right now.
North Idaho hospitals are still operating under crisis standards of care today amid the spike in COVID-19 hospitalizations. This comes as the number of coronavirus patients at Kootenai Health remains in the triple digits. Our own Ian Smay is live at Kootenai Health this afternoon with more on what healthcare workers are dealing with. Ian.
Tom, Mark, as of earlier today, Kootenai Health still had at least 108 COVID-19 patients, and of those, 33 are in critical care and 14 were on ventilators. Also, 9 patients are being treated in an overflow area set up in an area that's normally reserved for classrooms and conference spaces. And since August 25th, Kootenai Health says 87% of its COVID patients haven't been fully vaccinated. The situation here and throughout the region is causing a strain on the system. Leaders at Kootenai Health said there is still little ability to transfer patients, but one piece of good news from today is that Kootenai Health has been able to accept a few transfer patients this week from outside hospitals. Kootenai Health Chief of Staff Dr. Robert Scoggins said they are still admitting 10 to 15 new COVID-19 patients per day, and according to the nurses at Kootenai Health, the patients are people who say they didn't think the virus would cause them to need medical attention.
If they're able to talk, if they're not on a ventilator, a lot of them say, I didn't think that it would be me who's sitting in this bed. I thought it was either all political or all a hoax or just people who are in poor health or maybe don't take care of themselves as well who are getting this sick.
Kootenai Health does have about 70 people assisting with care as part of help from the federal government. They also expect that number to rise to about 111 in the near future. Another concern with the current situation is the cancellation of some important surgeries causing further problems down the road. Now, Kootenai Health leaders also said that one piece of good news is that the use of monoclonal antibody treatments has helped keep some people out of the hospital and keep some of those beds free. Coming up at 5 and 6 o'clock tonight, I'll have more on what nurses are dealing with as they're caring for these patients and what this all could mean and how it could affect care for younger patients going forward. For now, reporting from Coeur d'Alene, Ian Smay, Krem 2 News.
All right, Ian, thank you very much. We also had the chance today to talk with Spokane County's interim health officer, Dr. Frank Velasquez. He told us cases are up significantly in children. Right now, children make up about 1 in 4 new COVID infections. And since kids just went back to school in person a few weeks ago, we also asked if going back to virtual learning is something parents should start preparing for.
Are you keeping track of cases, positive cases in schools? And is there a threshold where you start to advise districts to go back to either a hybrid or an at-home model?
That's a good question. So we've seen an increase in children overall, not only in the country, but also in the community. So we continue to meet with our schools on a weekly basis and provide them advice, as well as provide them with mitigation, additional precaution and testing options, which most of them are actually using testing, so we can identify early. Our goal has been to provide our schools with all of the information, all of the tools, all of the decision points, and all of the support, so they can make decisions real time.
Well, in the end, each school district will make its own decision, as you heard, about virtual or in-person learning models. But Dr. Velasquez did emphasize how important it is for kids ages 12 and up to get vaccinated, because the overwhelming majority of new infections and hospitalizations are in those who are, again, not vaccinated.
So we know this is a lot of information for you to absorb right now. So all you need to do is text the word COVID to 509-448-2000 for links to our reporting on the coronavirus issues today. We'll send those right to your phone.
All right, let's pause from the headlines for a moment to talk weather, because Tom, pretty decent day out there today, but a bit windy, I noticed outside.
Yeah, a little breezy because we've
Right.
got some changes in the weather. I think we're going to get sunshine tomorrow, but temperatures are just going to be cooling down. There you can see the cloudy skies out there right now, and we are still on track for much wetter weather by Friday. Mark, look at that. Wind out of the west at 23. Our anemometer, Mark Hanrahan, ladies and gentlemen, with a first-hand observation. We're at 70 degrees. You can see the clouds that have just now begun to move into the area, but we're not seeing anything in the way of rain as of yet. Continued mostly cloudy with an overnight low of 40 degrees. We'll look for a high tomorrow of 67, even though we'll see plenty of sunshine. We're looking ahead to the weekend. It's going to be wet. Chance of thunderstorms even on Sunday. 62 the expected high for both days. I'll check the rest of your 7-day forecast coming up in a few minutes.
We'll take any rain we can get at this point, Tom. Thank you very much. And still to come here on Krem 2 News First at 4, a national bus shortage is now here in Spokane. After the break, we'll tell you what we have learned about why bus drivers are hard to come by now and how that's impacting our kids.